everyone. Welcome to this week's episode of Sip, Sip, and Synapse. Today we have Rachel Desjourdy, who is a 30-year-old woman with a disability living in Montreal. She works in the field of equity, diversity, and inclusion with an emphasis on accessibility. Thank you so much, Rachel, for being on this week's episode with us.
Thank you for having me.
So we thought we would start this conversation. Well, I thought we would start this conversation with maybe you describing to us your disability, if you're okay with that.
Yeah, absolutely. So I was born with a relatively rare genetic condition, considered a genetic disorder. It's a syndrome. It's called the acronym is EEC, and that stands for Ectodermal Ectrodactyly Dysplasia and Clefting syndrome. And in a nutshell, what that syndrome does is when you're evolving, as a sperm and egg, when you get to the blastocyst stage, everything that's in the ectoderm layer. So what that becomes is your skin, your hair, your nails, your teeth. So everything that comes out of that layer has a little bit of I would say malfunction, or just a little bit of a difference. So my hair is more blonde, drier, my skin is paler. I had a lot of missing teeth. I have almost no enamel. Some people it really affects their hands, so that's the ectrodactyly part. I don't really have that many. I have a few just differences with my fingers, and I had a webbed toes on one foot. But really, the way it impacted me the most is that as a kid at the age of 3, I lost my hearing. So I am hard of hearing. I've been that way for my whole life. And then there are other things that have come along with that. Like there's, I have a couple invisible disability issues with my bladder, and from being teased as a kid, your mental health gets affected. 100%. So there's a few other pieces that come along with it, but I would say that at the root, the underlying aspect of my health has always been EEC.
Okay, thank you for sharing and explaining that. You did mention it was a rare disease. Do you find yourself always having to explain it? Because I don't know how much people, let alone healthcare professionals, know about it. Do you find yourself always having to explain and educate and raise awareness regarding this condition?
Oh yeah, absolutely. I have literally been in doctor's offices where they've Googled EEC in front of me because they have no idea what I'm talking about. I think the best doctor I ever had, actually, after I met them, they had done their research. And so by the time I went back a second time, they had at least looked in the literature and said, there's not that much out there, but they had done a little bit of the research, and so I felt like they had made an effort. Whereas I feel like a lot of times health professionals, it's good to get people to explain how it impacts them, but it's also a little tiresome to always have to repeat or to give your 30-second elevator pitch to a healthcare professional because they don't have more time than that for you.
That's so unfortunate. But I think it's reassuring that there are some people who put the time into learning, because it's okay not to know, but the difference comes in actually putting the effort to want to know afterwards. So I was wondering, you had mentioned, obviously, it did have an impact on your life growing up and now. Would you be open to sharing a little bit of maybe the barriers you've seen that you faced in consequence to this?
Yeah, absolutely. So by the age of, I lost count. I think the last time I counted, I've had 25 surgeries, or 25 instances of going under general anesthesia. Wow. Sometimes multiple procedures were combined in a single operation. And most of them, I think by the time I was 20 and I had 20. So an average of at least one a year for my whole life. And I think, my first year of life, I had 3, and all of them were pretty extensive. Um, a lot of like plastic surgery to reconstruct my cleft lip and palate, a lot of surgery on my ears um, to try and fix some of the chronic ear infections that I was having as a result of my condition. So I think the biggest impact that having EEC has had on my life is, unlike most kids my age, I knew how to navigate a hospital. I have had many, many interactions, many overnights in the post-op recovery, many interactions with nurses, residents. And so on the one hand, you know, that means that when you go back to school or in a school year, you have to take off time from school, you go back, you're healing. Um, I remember as a kid, I kind of liked it when I had surgery because it meant that I could sit out gym. I hated gym class. Um, but other than that, like I think the most kids don't have that level of exposure because, or at least I hope, I don't wish that level of exposure on most kids, because that means that like health wise, there's usually you're not there just for fun. But I have to say, like, that has also given me a pretty strong sense of self advocacy, because I had to like speak up to the doctors and like talk to these people. At least when I was a kid, they're like 20, 30, 40 years my senior at least, but I have to tell them what I want. And I remember when I turned 14 and I signed my first consent for surgery. I guess 14 was the age when you signed your own papers and it wasn't your parents doing it for you. And I felt like pretty powerful to make my own decision.
It is definitely a big thing, and I think it's empowering too to allow you to make your own decisions, even at 14, because people often get surprised, like, wow, 14, but for someone, especially like someone like you who has had all that experience, it's all the more reason to be able to put you in that position. So given that you had so many years of experience within the hospital and whatnot, I'm more than certain not every experience was positive. Would you be open to sharing some of both maybe the positive and some really negative experiences that you had to deal with?
Yeah, for sure. I think when it comes to, there's two experiences that I had, one with a nurse and one with a plastic surgery resident, that stick out as overwhelmingly positive. I don't like, I think I really believe that there's something to be said for medical trauma, because I actually don't remember a lot of what I like went through. But these two occasions, so this one example I'll share of a nurse. Um, this was a surgery I had had. It was major reconstruction in my mouth. I believe I had had a bone graft from my hips into my mouth to reconstruct a piece of my palate, and as a result was very limited into what I could eat. And if I remember correctly, I was several days overnight at the hospital in post-op care. And of course, you have surgery on your mouth, major plastic surgery, they're going to put you on a liquid diet. And the hospital's like menu in terms of liquid diet looks the same for breakfast, lunch, and supper. And it was so restrictive that I couldn't even have Jello. Jello is like usually a borderline of
Yeah.
like liquid diet, but it was like ginger ale and chicken broth.
Oh my
And
goodness.
I was so done. I think it was probably like 3 days after my surgery, and you're not feeling your greatest, but you are recovered enough. And all you want to do is go home. You want to eat things that feel comforting. My favorite food in the world is spaghetti. And this one nurse, they kept having to wait for the doctor to clear me and to eat soft food. And this one nurse who worked in the post-op care unit actually like hunted down the resident because she knew that like time-wise I should have been clear on that day, and like how miserable I was. And she came to me and she said, um, she presented me like all these vouchers for the cafeteria and said, you know, you're on soft food now. They're serving spaghetti, which is my favorite meal of all time. You can like take these vouchers and go pick what you want from the cafeteria. And I just remember, you know, the fact that it was spaghetti, I was able to get a milkshake instead of ginger ale. The fact that the nurse really went out of her way to do something to make it less, I don't know, just like less boring, less
Yeah.
like completely out of your control. I don't know. I thought that was like something that as a healthcare practitioner, knowing your patient, knowing like a little bit about their personalities, what their likes are, you may not be able to make them super comfortable. You may not be able to take away, you know, some of the pain or discomfort that they're feeling, but there are things that you can do to make their stay better. So that was one like really positive experience that stuck out to me. The other one was, this was a different surgery. Again, major reconstruction. This time it was on my nose. And the way that the surgery had went, I was having a skin graft, and so they took my bottom lip and grafted it to my top lip, and
Wow.
they took the skin of my top lip to make the bottom bridge of my nose. And so while the bottom lip graft was taking, I essentially had to have my lips connected. So they were essentially, my bottom lip was sewn to my top lip, but not severed from the bottom for 3 weeks. So that was the first surgery. And you know, no nasal surgery to begin with, you're swollen, you had a hard time breathing. But on top of that, my mouth was like essentially sewn shut and I couldn't breathe very well. I remember having a really difficult time, you know, going to the just walking down the hall to go to the bathroom because I'd be so out of breath. And sometimes I would actually take a straw just to like part my lips so
Oh
I
my
could
goodness.
breathe a little bit better. But what would really help is when my nose was cleared of like mucus and, you know, just like the everyday debris that I couldn't clear myself because there were stitches in there. And I remember the resident who had assisted in the operation, I don't think he had more than 4 hours of sleep that night. And he was pretty tired, but he responded to the call and literally came in post-op care and essentially glorified pick my nose, you know, like literally took the tweezers to remove the boogers from my nose to clear my airways enough that I was like so much more comfortable. And I mean, like medically speaking, other than my comfort, he could have just left it there. But I just remember that moment of like relief, being able to breathe for a few more hours, and just knowing that I was so much more comfortable. So those I think are two examples of really positive care that I've received where, you know, it's about more than just doing your job and like checking the boxes off the list. It's demonstrating an attention to like the human being that's in front of you, and figuring out what you can do to support that.
Absolutely. And I think like it's really important to us to remember that it's really simple things that can go such a long way. Simple things that make a huge difference, and it's minor things, minor actions that will take a few minutes out of our day to bring a whole world of more comfort, happiness, just joy in everyone that's there. Like nobody wants to be in a hospital, but if you can be in a hospital and get spaghetti and you love spaghetti, then why not? Yeah,
Yeah.
that's really, really comforting to know. And I do hope people listening realize that it's just really a few actions, few seconds, few minutes out of our days make all the difference.
Yeah. And I mean, everyone has bad days. You're not always gonna have like a smile on your face, but I think for the patient, especially like I don't know, I've met other kids going through surgery where me it was my 10th and I know what I'm doing and I'm like pretty calm about it, but they're really nervous.
Yeah.
And having someone who helps to de-escalate, like smile, be very calm, instead of just like grumpy and in and out.
Exactly.
It
Exactly.
makes a huge difference.
Yeah, ultimately. Um, I was wondering, while we heard the positives, would you be able to speak more about the negatives? Because although I love hearing the positives happen, I think the negatives also provide its own, I guess, stories in terms of what we can learn from or what we can improve on in terms of the care we give.
Now, I think in terms of negatives, something that's like a huge pet peeve of mine is doctors have to remember that like they may have, or I'm saying doctors, but it can really be any health professional. They may have be having like a 5 minute interaction with me and come up with their own assumptions about like what I need and like what procedure to follow. I've been in this body for 30 years and I've like seen things and experienced things. I've been on different medication, and I'll just give an example is I've started to be more vocal about like directing my care. So especially for like post-op um, pain relief, I personally have had really negative experiences on like morphine because it really impacted my bladder. And like for me, it was so much more. I would rather deal with the pain from my surgery than the pain that the morphine
Oh my
caused to my
goodness.
bladder. And when you tell a doctor, like you ask them to explain to you what kind of pain relief they're prescribing, you ask for alternatives, or you're like essentially like negotiating your care, that doesn't go over well. And I think that having more agency in the process whenever possible, I think is really empowering. And I think it's a shame that that doesn't happen as often. I feel like most of the time in those interactions, I'm always like triple questioned. It's like, are you sure? Really? Come on now. And there's like an element almost of consent that is missing. So I would say that that's a negative, and then especially having been through the healthcare system as a kid, um, I think that people underestimate how empowering it is. Well, how disempowering it is to have to be in a meeting with your healthcare provider and to have them talk about you to your parent while you're in the room. And I think like it doesn't matter how old you are. I think that you should be able to speak for yourself and you should be able to like describe. Of course, a parent or a caregiver can supplement and provide additional context, but I really think that um, being patient centered, especially like in pediatrics, is really has a long term consequence because it teaches like self advocacy. It also
100%.
helps for, you know, I think alleviating some of that sense of disempowerment that can come from not having, not necessarily understanding everything that's happening to or with your body, but feeling like you're in dialogue with someone who's caring for you. I think that that's one thing that I wish happened more frequently. And then, the other negative is I've had healthcare practitioners that just don't talk. It's like I could have been a bag of potatoes
Oh my
and,
goodness.
and then, come in, do their thing. And I think, maybe it's for some people, it might be a self-defense mechanism to like kind of go in and focus on what they have to tackle rather than the whole person. But your patients definitely realize that.
Yeah, and I kind of find it hard to believe that people will go into a profession where you're entirely working with people essentially, and you don't want to talk to them. That's quite interesting, and I don't know if I've ever personally encountered that, but I do definitely know the not talking to the patients directly has come up quite often. Um, and although there is work being done to try to improve it, it still does happen a lot, which is unfortunate. But yeah, I 100% agree. I think it's just centering them in the conversation is just so much more powerful, and essentially, as you said, gives them the confidence in themselves to know that what they are saying is accurate, and that they're not crazy for feeling how they feel, and that we actually believe everything you guys are saying. Yeah.
Yeah, absolutely.
Yeah.
I think another, sorry, just to bounce this off is one barrier that I've seen that has actually been amplified since COVID is um, the lack of accessibility awareness within the health professional. Like I find it really interesting that despite the main clientele of the healthcare system not being like an able-bodied person, when you think about the way instruments are designed, the way examination rooms are built, the examination tables, even in times of COVID, like do any healthcare practitioners have access to a clear mask to communicate with someone who's hard of hearing? I haven't seen that yet. As someone who's extremely hard of hearing, well, who's moderate to severe hard of hearing, I have found it extremely difficult, but the onus has been on me to adapt to the healthcare system rather than, you know, being flagged. I'm always worried. I'll give another example of how, it doesn't exactly work super well for me when they're using intercoms to verbally call your name. First of all, I'm always terrified that I will miss or misunderstand when they call my name. Second of all, because I have a bladder condition, if I'm waiting in the waiting room and I have to use the washroom, intercoms don't usually
Yeah.
go into the
Yeah.
washroom. And you can imagine how frustrating it is to, be waiting sometimes for hours uh, for your interaction with your healthcare professional, and then always have this underlying anxiety of like, did I miss it? Like, am I gonna miss my name? And that, I think, especially for hard of hearing patients, is quite disempowering. It would be nice to, I would love to be able to flag in my chart that I'm hard of hearing. And so if practitioners need to reach me, they get a picture, they look for me in the waiting room, and they, come and get me rather than calling my name on a muffled intercom.
That's actually, you know, uh, being fully honest now, I obviously I've heard about it and I heard about the barriers, but I don't see anything that's been done to actually accommodate, or anything that I can say like, yeah, like there are accommodations. Exam rooms are made like, absolutely right, they aren't. And especially in COVID, there aren't much being done. We're in masks, we're covering our face, you see eyes, and there's already as is hard to communicate, and then people with difficulties with hearing or whatever it be, it's just a million times harder. So that's
And the thing
absolutely.
is that the solutions exist, right? Like, I'm not asking, for example, a health practitioner to remove their mask. I'm just asking to wear an alternate that's equally productive, and then suddenly there's access for both of us. And it's the type of thing where, as someone who works in the field of accessibility, I think people with disabilities are very creative, found workarounds for a lot of the barriers that we face in our life.
Yeah.
And it would be so beneficial if that was actually part of the medical curriculum, to think about accessibility as a concept, not just like disability in the context of health.
100%. I think that's the huge component that's lacking. It's just normalizing that access to care looks different for different people. And that shouldn't be a deviation from normal, but should be the new normal, essentially. And I think that's where we need to work towards, and that's the gap. So I hope
Absolutely.
everybody listening kind of hears that and like works towards finding little ways, but it doesn't, as you said, have to be significant change. Even something as little as flagging your chart and saying, hey, can you just walk out to the waiting room instead of calling this patient's name, just to let them know it's their turn. And that's
Yes.
not, it doesn't take significantly much more effort to do that, in my opinion. So yeah, I'm going to try to suggest that the next time I see anything like that on a file, or even in the hospital, like any ward, anything, wherever it is, a clinic, because I think that does make an, I panic when I go to the bathroom at a clinic. And mind you, I don't have a hearing impairment, so I can't imagine how you feel having to navigate all that. So wow. Yeah.
Yes.
And I think it comes down to the whole theme of again, ableism in healthcare, and how we can and should, and how can we like move towards addressing it, essentially.
When I think about, there's a lot of really great work right now being done to acknowledge, unpack, identify, and repair issues around, for example, racism in healthcare. About how even our curriculum. I think about our anatomy textbooks. Like they're all white people. Like you see like the dermatology unit on white skin, but like, what does that look like for the such a diverse country with so many skin tones? Like, how do you diagnose conditions if you don't have a spectrum of what you're looking at? And I think that there's so many lessons that we can learn from the learning that's going on right now in terms of the racial biases in our health system, and actually bring in and bring up ableism into that conversation. That's something that I see a lot, is especially as we talk about equity, diversity, inclusion. These are terms that are becoming more and more popular, or at least more like widely known.
Yeah.
Like most universities have an equity, diversity, inclusion officer. A lot of companies are hiring someone in that area. And I think there's a huge potential for medical education to actually address that gap, but the first step is to acknowledge it as a gap, and I don't think that we're there yet. It's projects like this, but it's also there's like two things. There's like patient advocacy, but we also need more healthcare professionals with disabilities sharing, or like health conditions, sharing their experiences to influence their own medical education and take that into the curriculum and beyond.
Yeah. And I honestly hope we can get there. I feel I feel like medicine, healthcare in general, it's a quite complex in terms of the levels that need to be broken down. There's a lot of, the culture was always like a very go 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 culture. Um, don't show you're struggling. Don't show you have problems. Just deal with it. And I think we are slowly changing, and there has been huge strides made. Uh, but there's a lot to deconstruct, and I hope we can deconstruct that, and while addressing everything else that we need to be addressing. But I honestly, I know I'm saying a lot of like, oh, there's a lot of work we need to be done. There is definitely change that is being made, more recognition, more people showing interest. Obviously everything comes with time, and change is slow, but I am optimistic that we will work towards it, at least. Maybe not get there right away, but we are slowly working towards it. um
I
but
hope so.
I think so. I hope so too. but I think that's why I feel like hearing it from you guys, hearing your experiences, hearing what we can do to improve care, um, and essentially just learning from you guys how we can be better is also at the core of it. Because without you and your experiences and everyone else who has shared their experiences, we can learn as much as we want from textbooks, but it'll never be real and honest truth of the experiences people live through. So thank you again. I really, really
You're
appreciate it.
welcome.
So I think I can use that as transition to my next question. Um, I know this is probably not there's no simple answer to this ultimately, but what do you think we can do um, on a day-to-day basis or during our rotations or when I, let's say, become a professional a couple of years? How can I improve care essentially? What can I do myself or with my colleagues or in the environment I'm in to be better?
This is a
Yeah,
big question.
it is a big.
I think I think one of the things, so there's a couple of things. One is I definitely think that all healthcare professionals should be seeking out the lived experiences of people who've gone through the healthcare system. So like it's not enough to just surround yourself with people who are working in the healthcare system. You want to like really like whether it's audiobooks or stories or like your news articles, patient advocacy Facebook groups, the more you're exposed to realities that are different from yours, the more aware you'll be, and that you can bring into your work. So I think that's the work that you have to do, because it's not necessarily, you know, not everyone is going to have the energy or bandwidth to like tell you what you need to learn, because
Exactly.
there's so much out there already being produced. So one, I would say for sure seek that out. The second thing that I think people can do is once you have like a baseline awareness of essentially human variability, when you're going through the different units, I'm thinking about like whether you're in physiotherapy or in nursing or medicine, start asking those questions. How would I do this technique if my patient was a wheelchair user? Like I know like in an ideal scenario they're lying on the table and like I've rotated them and I'm able to do this and this procedure. What do I do if this happens? How do I adapt my instructions or my patient dialogue when I know that the person is deaf and a sign language user? How do I adapt when I know that there's like a communication barrier because of an intellectual disability? Practicing, first of all, asking yourself those questions and integrating that mindfully into your practice, just so that you can build your arsenal. It's not necessarily using new techniques, but figuring out how you can take the principle and accommodate the people that you're working with. I think the last piece, and I think we all do this. This is not unique to anyone in a healthcare profession, but the more you learn, the more you can check your own biases about assumptions that you make, whether whether it's like at first glance, you're meeting hundreds of people, thousands across your career. You're going to meet tons of people. And I think it's really important to be super aware of the unconscious biases you're making and like how to keep those in check. You'll never not make unconscious like discrimination, but the more you're aware of it, you can actually counteract, or you can say like, I realize that for example, when I'm dealing with patients who tell me that they're blind or low vision, I start talking louder rather than actually like communicate with them about what they need.
Yeah.
I've had friends who are blind or low vision, and they always joke. They're like, "Yeah, when people find out that I'm that I'm blind, they turn up the volume, even though it has nothing to do with my ears." And it's just little things like that. I remember when people found out that would find out that I'm deaf or hard of hearing, they would suddenly slow down and start over articulating, and for me that's like not helpful at all.
Yeah.
And so I think it's genuine curiosity. If someone discloses to you and they're like, "Oh, okay, like that's interesting. How would you like me to use that piece of information in our interaction today? How can knowing that help me be a better carer for you?" Like really flipping the question back, and again censoring autonomy, self-determination, I think are really key.
Yeah. And I think ultimately it comes down to communication. If that's shared, like what can we do to make care as it should be? Like what can we do? What adjustments, what adaptations would you like me to make that would be helpful to you? Yeah. I think that's practical enough and easy enough for anybody to do. And it kind of should be the norm. So
And I think the one thing I'm just gonna bring up here is that sometimes it's really easy and be like, okay, like what should I do? Like I'm having help, just tell me what to do. And I think I would caution, especially healthcare professionals, actually do the extra step of coming up with an idea and presenting. Be like, I'm like, sure, like let's see what we can do to make this better for you. I'm thinking of doing this. Would that be helpful? Because I think, especially in a position where you don't have much power
mhm.
in the situation, you want to be able to rely on your healthcare professional, and in situations of anxiety or like increased pressure, you may not, your self advocacy skills may be impacted. And I always find it really powerful uh, when people who want to be allies with the disability community say, this is how I'm thinking of adjusting the way I normally do things to accommodate what you just told me. Does this make sense? Or like, do you have a better idea? Instead of automatically flipping, like, I'll do whatever you need
Yeah.
me to do. Just tell me how to do it.
Yeah. So instead of putting the entire work on the patient, it's working with the patient. I think that's the key message. Yeah. 100% agree with that. Yeah. Yeah. And I think the mistake I often end up unconsciously doing too is it's a shared responsibility rather than having you guys have spent your entire lives having to advocate, having to work, having to raise awareness. So at a certain point, it's more of a collaborative, hey, let's work together. This is what I think. This is what we can do together. What do you think? And it's just a back and forth of communication rather than like okay, tell me what to do. Tell me what I'm supposed to do. I
Yeah.
think that's a good lesson learned, even for me. Like, I'm going to try to keep that in mind. So I think on my end, that's all I had to ask. Is there anything else you would like to share?
No, I think, this is a topic that I am super passionate about. I always have like a little pipe dream that one day I'd be able to work with the medical community to actually co-develop like ableism in medicine curriculum. I think it's important to manifest our dreams. So I'm just putting this out there into the universe. But I think about like the kid that is me. Like I think I would have benefited, and even as an adult, I continue to see a difference when my healthcare practitioners are in tune with the lived experiences. And I think it's something you can't really put your finger on it. You can't really like tangibly quantify it, but you can tell the difference when your practitioner is like genuine and and not just well intentioned, but like gets it. Yeah, and I think that that would be beneficial for the next generation of medical science.
I think I'm gonna manifest and send you all the energy to make that happen as well. But I do think it would be awesome if we can get to the point where that gets integrated into the curriculum. So sending all the energy, anything that's needed, all the aura to try to make that happen. But yeah, all to say, thank you so much for really participating in this episode. It was informative, inspiring, and eye-opening. And I think I learned more than I anticipated to today's. And I hope people listening also take away as much as I did today. So thank you again, Rachel.
You're very welcome. Have a great rest of your evening.
Thank you.